There are some changes coming to Medicare this year, a lot more than in previous years. So there's a lot going on with Medicare that we need to be on top of and make sure that we understand so that we don't get hit with surprises and then come January of next year, we're all of a sudden in the wrong place. So we need to understand exactly what's coming. I'm gonna go through that right now. I'm Keith Armbrecht, founder of Medicare on Video, help people across the country make the right Medicare choices. We actually enroll you into the plan, so it makes it as easy as possible to get everything done that you need to have done. So we're going to talk about the changes that are coming to Medicare this year, and it's going to be a big year. I want to take a quick minute and invite you to join my private Facebook group, Talking Medicare. It's a great place to find answers, to ask questions without having any pressure from other salespeople or insurance agents. It's a bunch of people on Medicare talking about Medicare with their experiences and things that they need to understand. So take just a minute, visit talkingmedicaregroup.com. It's absolutely free. You can join right there. Hope you find it very helpful. Enjoy the video. So primarily, especially Medicare Advantage, you're going to see a lot of changes with Medicare Advantage plans. So if you're on a Medicare Advantage plan, you need to make sure that you are on the lookout for your annual notice of change letter, the ANOC letter that comes in your mailbox, usually about the end of September, and tells you what's going to change on your plan. The good, the bad. This year it's going to probably be more bad than good. So you want to make sure that you find that letter, understand it, so you know if there's things that you need to do. Because this year it's going to get crazy in open enrollment, and it's going to be difficult to reach people because there's going to be so much transition going on. With Medicare Advantage plans, there's a whole bunch of talk about SARs, S-A-R. What is a SAR? SAR stands for Service Area Reduction. So what would a service area reduction actually be? It means they're leaving. They are pulling out of that service area. So you will see a multitude of plans where if you're on a Medicare Advantage plan, you may get notice that says, we're gone. We're not going to be here next year. You need to find other insurance coverage. So you need to make sure, especially if you're in a rural area, big cities may not have as many SARs as what's going to happen in the more rural areas. So if you're on a Medicare Advantage plan, make sure you look for that. If you see service area reduction or SAR, you need to pay attention to that and understand you are going to make a change. And sometimes they're going to try and push you into a change. You don't want that. You want to make sure you do whatever you find best for you in that situation. So just make sure you understand that. Medicare Part D, prescription drug plans, also going to have some pretty big changes. That's one of the big changes coming that I'm going to talk about right now. Primarily, they're going to cap out-of-pocket expenses on a Medicare drug plan to $2,000. So if you have expensive medications, crazy expensive medications, which certainly some folks do, especially, God forbid, you have cancer or something like that. Some of these medications can be super expensive, even with a drug plan. So now the cap on a Medicare drug plan is going to be $2,000 a year. And that's terrific for the folks that reach that. And unfortunately, or fortunately, it's a small percentage of folks on Medicare drug plans that reach that out-of-pocket limit. But there certainly are ones that do. Now, what will that do on the flip side for everybody else? It's going to raise premiums. So when they step in and they create, and again, this is the government, this is part of the Inflation Reduction Act, which certainly has nothing to do with reducing inflation, but this was in that bill where they made this cap, and then the ramification to everybody else, it's going to raise premiums because that cost has to come from somewhere. It doesn't just magically happen. It has to come from somewhere. So when they put in these protections and things that they tell you are good for everybody, it's good for some, but it's not necessarily good for everybody. So we're going to see an increase in premiums on Medicare Part D drug plans. So you will likely want to shop your Medicare Part D plan this year. It makes a lot of sense based on what you currently take. And what you don't want is you don't want an insurance agent selling you into a Medicare drug plan because it may not be the best one for you. It's very easy to do this by yourself. I have a video right here, walks you right through how to do it on Medicare's site with the Medicare Drug Plan Finder. Again, really easy to do. You just put in your medications, put in your pharmacy, and then it tells you the best drug plan based on what you currently take. And then you can enroll right there without having to talk to anybody, or again, having somebody sell you something that may not be the right one. So take a minute, figure out what the best plan is for you. You may still have the best plan, but go on Medicare's Drug Plan Finder, put in your medications, and make sure that we figure that out. Another change that's coming to drug plans, they are now going to have a prescription payment plan. So you can put your prescriptions on layaway, basically, which, I don't generally recommend spreading out payments on something that you should be paying for as you go. But again, sometimes the costs can get out of hand and budgets can't handle the costs. And if you're one of the ones that caps out at that $2,000 and maybe you even cap out early in the year, it can be a burden. And so now they're going to have a prescription payment plan where you can spread that cost out over the year. So it should benefit certainly some. I wouldn't recommend it unless you need it, but if you do need it, it's there to utilize. So it can be helpful to the ones that have that higher out-of-pocket cost on their prescription drug plan. There's also going to be some changes to telehealth services, where I don't know why we don't improve telehealth services. I was just talking about this with my wife recently, that man, it's so much easier if you could just Zoom call with your doctor. They don't necessarily need to have a physical encounter with you to be able to understand exactly your symptoms, especially if you've already seen them previously and this is a follow-up and you need to have things done in a quick fashion. Why in the world we can't have better telehealth services? But we're going in the opposite direction with Medicare, where now telehealth is only going to be available in rural areas. So the doctor's office has to be in a rural area. I'm not exactly sure how they define the rural area for telehealth services to be available. And again, it doesn't make sense to me, because in a big city, it can be more complicated to get to a doctor than it is in a rural area. So I'm not sure why we would take it away. It would also seem to be much more cost effective to be able to just Zoom call with doctors and handle things that way versus physical appointments in the office. It just doesn't make a lot of sense. But that is a change that's coming to me. It's a downgrade, absolutely, with telehealth services within Medicare. And I would start the Let's Better Our Telehealth Services petition. And again, why in the world we would want to limit that, I have no idea. But telehealth services is going to change a little bit. If you were using it previously in a city environment, you may not have that ability to utilize going forward. Now, there are some changes coming to mental health and wellness, well-being, and something they've tried to grab hold of recently, and they're trying better. And again, mental health will still be available on the telehealth services, which is terrific. And again, everything should be, but mental health and well-being will still be part of telehealth. But in the annual Medicare wellness visit, there's something else that's very complicated. Make sure you understand this, especially if you're new to Medicare. The wellness visit is not an annual physical when you go to the doctor. It's a kind of a welcome to Medicare wellness visit where it's very limited. They don't do a whole lot. They basically take your pulse and make sure you're breathing and then send you on your way. So that is in the wellness visit with Medicare. They will also incorporate a mental health assessment where if you're determined to have mental health needs, they can then refer you to the appropriate places. So it will kind of include a little bit of mental health and well-being into that annual or that Medicare wellness visit. There are a couple of other changes that are coming. They're going to have more resources for caregivers, so there'll be more training for caregivers, things of that nature. There's also going to be some changes for postal employees, where they used to be on the federal health insurance program. They're now going to go on the postal insurance program. It's going to be a little different, and I'm not sure, haven't heard any big uproar from the postal union on this, or I'm not sure they really have a full grasp on how it's going to affect them, but it sounds like it may affect future beneficiaries of the Postal Service, where they may not have had to have, or they may not have had to pay for Medicare Part B previously, but in the future they will. So that could be a pretty big thing. So if you're a postal employee, you want to look into that to make sure that you know exactly what changes are coming for you. So those are some of the changes that are coming. And again, I will update this as we go along. Make sure you subscribe to the channel. That way you'll get the videos whenever something new comes out. We talk about it, we figure it out, we make sure we know what's best for us. And this is what we do. We help people with Medicare. I'm an insurance broker. I find the best Medicare supplement plan in your zip code in any of the 50 states. We make sure we get it right the first time. We roll you right into the plan. So we take everything off of your plate, just make it as easy as possible. There's no cost to you to allow us to help you. So hopefully you'll allow us to help you. It's what we do. And you'll find out thousands of happy clients. You can read all the Google reviews. We make it as easy as possible. So make sure you subscribe to the channel. Download my book on Medicare. It's below the video. It just keeps things easy, and that way you're comfortable with your decision. So I hope you found this helpful. Have a fantastic day. Here's another video that I think you'll find very helpful with important information about Medicare that you really need to understand, even if you're already in Medicare. And then below it, there's a playlist that has different videos that cover smaller topics and makes it easier to understand things that you need now and in the future for Medicare. So I hope you find them helpful. Have a fantastic day.